Welcome everyone to this Geneva Peace Week event where we discuss about the role of research, education and healthcare institution in peace-building community at COVID-19 times. To start with, I would like to welcome as intervention by the Deputy Minister of Research and Technology, Dr. Christos Dimas. I would like to thank Dr. Dimas for honoring us with his presence in such an important event about research, education and healthcare during the COVID-19 pandemic. And their role in peace building, we are well aware that Dr. Dimas and the colleagues at the Ministry give a new impetus to research and technology evolution in Greece. Thank you again, Minister, for your very important contribution in this international, very important forum.
We live in a very challenging period. COVID-19 has become a global challenge impacting economy, society, and all aspects of life. It has changed our lives regardless of race, sex, nationality, language, religion, or any other status, in our households, workspaces, neighborhoods, and countries. The reality is that in order to ensure safety and prosperity across the planet, we will need a vaccine that has been thoroughly tested and is scientifically safe and effective. The pandemic has made everyone comprehend how vital researchers and scientists are for humanity and therefore for peaceful well-being. It is remarkable that scientists from all around the world are cooperating and coordinating the response against the COVID-19 crisis. In short, they are giving the right example. Science ensures prosperity, stability, and global peace. The European Commission has been at the forefront of supporting research and innovation. It is funding, through the Horizon Initiative, the EU Research and Innovation Programme. That includes up to 45 million euros of the Innovative Medicines Initiative and the fast-track call for research proposals in response for the coronavirus outbreak. A commitment of a similar scale is expected from the pharmaceutical industry so that the total investment could reach up to 90 million euros. This comes as part of the coordinated EU response to the threat of the coronavirus. Governments are facing multiple dilemmas on the road to the right decisions and policies against the spread of the pandemic. In Greece, we are implementing a flagship research action designed and funded for the epidemiological study of COVID-19 amounting to 2.45 million euros. 6 research centers and 4 universities have united their forces with the Hellenic National Public Organization and the Committee of Experts of the Ministry of Healthcare under the coordination of the Ministry of Development and Investments. The main objective of the research action is the development and application of domestic molecular and immunological diagnostic methods for the treatment of the SARS coronavirus pandemic and the genomic analysis of the SARS coronavirus genetic material and assessment of virus-host interaction. The lessons learned throughout these months can help redefine and strengthen education, research, and healthcare systems in the long term. The international society needs to take stock of the innovative and effective solutions provided during the crisis and gear particular attention towards best practices in the post-COVID era. In short, the pandemic crisis has proven that science helps build bridges between companies, academic institutions, countries, and people in order to achieve solutions for common problems and ensure global well-being and peace. Thank you very much for giving me this opportunity to address the Geneva Peace Week, and please stay safe.
I would like to thank also the Hellenic Association of Political Scientists for organizing this event, which marked the 50th consecutive participation within the very important institution Geneva Peace Week. At this point, I would like to warmly thank the President of HAPSc, Mr. Simeon Sidiropoulos, who has created the capabilities of actively participating the last 5 years in this high-level international forum for peacebuilding and conflict resolution. It is of great importance, especially these years, since our application for this scientific event was accepted among over 170 applications, the most the Geneva Peace Week has ever received. We are very honored by the presence of Professor Antonarakis, whose participation offered extra validity to our event proposal, as well by the participation of very important professors and speakers who can offer extremely useful insight through their knowledge and scientific opinions. And now, please, Professor Antonarakis has the floor. Professor Antonarakis, floor is yours.
I thank Dr. Rapti for the very generous introduction. I'm Stylianos Antonarakis. I'm a geneticist at the University of Geneva, and it's my great pleasure and honor to participate in this particular event. As I said, I'm a geneticist, so I will talk to you a little bit about our genome, which is the field of our investigation, and how the genome relates to peace. You may think that this is an unusual link, but I hope that at the end of the presentation, I could convince you that the reading of our genomes greatly contributes or could contribute to the world peace. So if you give me a second to share with you the presentation. Right, the title of the presentation is Genome and Peace, and I have a subtitle, Genomic Variation, the Common Treasure of Humanity. I like to thank the organizing committee and Dr. Pari Rapti for the kind invitation, and I also want to thank all the members of our laboratory and the funding agencies that support and supported in the past our research, the Swiss Science National Foundation, the European Union, an institution with the European Union that's called ERC, the American NIH, and 5 foundations, Ludwig Gebert, Lejeune, Proviso, and Child Care, for the support over the years. Let me start with a political slide. I take you back to 2008, where it was an election year in the United States, and the two opponents were then Senator Obama and then Senator McCain. And in the New England Journal of Medicine, the most important clinical journal on earth, there was a paper by Robert Greene, a biologist, and George Annas, a bioethicist, who said that in this election and in the future elections, it would be nice to know part of the genomes or the entire genomes of the candidates in order to be more informed in our decisions to vote for one or the other. And the underlying statement was that the reading of the genome of the candidates or the reading of the genome of each one of us is quite important for our personality and for our life history. 2008, we are 12 years later, and I would assure you that we're not there yet. You have to give us a few more years to make this proposal true. So what is genetic medicine, and what is this thing about the genome and what we are? What we are, let's call it a phenotype. All the traits and the characteristics and all the disorders that we have I made this as in a graphic to the right of your screen here with circles, and each circle is a different phenotype, a different disease or a different trait. And in the right part, in the left part of your screen, there is a representation of the genome. Within that genome, there are squares that represent the different functional elements of the genome, the genes or other functional elements. And the game that the geneticist plays is to link genes or functional genomic elements with characteristics or phenotypes. And sometimes the game is easy because one gene links to one phenotype, but usually the game is more complicated because one functional genomic element, one gene, relates to more than one phenotype, and vice versa, one trait or one phenotype relates to more than one gene. So let's see what is that genome. In each one of the trillions of our cells in the nucleus, there is a text of information written with 4 letters, 4 building blocks. Let's call them letters A, C, G, and T. So this is a part of my genome, about 10,000 letters, 10,000 nucleotides. And the genome of each one of us is 310,000 times bigger for a total length of 3.2 billion letters. And we receive 3.2 billion letters from our fathers and 3.2 billion letters from our mothers. So we have about 6 billion letters in our genome, and that characterizes most of the qualities, most of their life history, and a large number of disorders that we develop as humans. The DNA, the genome, is fragmented in the chromosomes that you see here. The chromosomes within the cells are, you can compare them to, let's say, the buses that transport the DNA from one cell to another or from one generation to another. I draw your attention to this very small chromosome here that you see, chromosome 21, which is the smallest human chromosome. And the smallest human chromosome is 1.6% of our human genome. And I convinced the Swiss Institute of Bioinformatics a few years ago to print in a book the genetic content, the genome of chromosome 21. Of course, this is an online presentation, so I cannot give you the book to look at it. But if you type each letter, each nucleotide with a size of 7 in your typewriter or your computer, imagine that when you type normally, you type letters of size 12. But if you do a type 7, size 7, you need about 1,470 pages to write down the chromosome 21 genome, which, as I said, is 1.6% of the total. And if you like to write the whole text of our genome, you need about 80 volumes of that size, an enormous text of information. Of course, it is enormous, but it is finite. And because it's finite, we can study it. And the human genome, you can compare this to the achievement of the complete and correct human anatomy by Andreas Vesalius and his students in Padova in Italy. And as you know, the correct human anatomy was published in Basel in 1543. And that changed the way surgery developed and many other specialties were developed, because structure infers to function. So the human genome, you can have it as the book of the genome anatomy in our cells, something analogous to the Humani Corporis Fabrica, which was the title of the anatomy text. So here is the wonder of the inheritance of the genomes. On top, with 170 volumes of the Encyclopedia Britannica that some older people will remember, is the genome that is passed from the father to the offspring, the son or the daughter. And on the bottom is the female genome, the genome of the mother that was passed. And then you have a new organism or a new member of our species. The interesting thing is that genome needs to be copied from one cell to another and from one generation to another. Imagine to copy 6.4 billion letters. The copy of this is a fantastic and wondrous mechanism. And the copying is extremely faithful, but without, but with some small mistakes. So every time we copy the genome from one cell to another, or from one generation to another, we accumulate a bit of mistakes. Like from this cell to that cell, or from this generation to this, there's one mistake here that we call mutation. That makes this red A. The next generation makes another mistake, the next generation more and more and more and more. And as we produce more cells in a body, or as we produce more members of our species in our history, we accumulate mutations. How many mutations we accumulate? In our terms, 1/10 to the -8 per nucleotide per generation. That means one mistake in every 100 million letters. And this very small mutation rate makes the genomes of each one of us a bit different from the previous generation. The average newborn has approximately 50 to 100 new mutations not present in the parents. And interestingly, most of these mutations occur in paternal cell divisions or paternal gametes, and the mutation rate doubles every 16.5 years of fathers. So here is that page of my DNA that has about 10,000 nucleotides, and with flags here, I show the nucleotides or the letters that differ from the reference genome. One in about 1,000 letters, one in about 1,000 nucleotides vary in two randomly selected genomes, and therefore we're all different from each other. There are not two people on the planet that have identical DNA, except the monozygotic twins when they start their lives. And even the monozygotic twins, they diverge after, because for every cell that every somatic cell that they produce, there are additional variants. So all of us, we belong to the Homo sapiens sapiens, but we are different in about 0.9% of our genome. And this difference makes the fantastic variability, the human diversity that we have as species. We have different intelligence, different characteristics, different orientations, different artistic tastes, different ways we look, and all of that is written in the variability of the genome of each one of us. So why do we have this? We have this because this genomic variability provides the possibility to evolve and to adapt in the ever-changing environment. We need this variability. And the obvious secret is that the genomic disorders and many disorders is the price to pay for the potential of evolution and adaptation, because some of these mutations cause disorders. So in other words, there's no free lunch in this world. We pay for everything we have. And to have the possibility of evolving and adapting, we pay with the rare genetic disorders that some of our fellow humans, they develop. And to quote the great population geneticist Theodosius Dobzhansky, nothing in biology makes sense except in the light of evolution. And I would say nothing in medicine makes sense except in the light of evolution. So because of this variability, in my generation, a new type of medicine was developed, genomic medicine, medicine based on the genetic variation of the individual. And that medicine is important for the prediction and diagnosis and prognosis and treatment. And I will not talk to you about medicine that much from now on, except to emphasize again and again the variability. If you think about medicine, or the cause of disorders has two branches, the genomic variability branch and the environmental variability branch, and the interaction between the two. And I challenge each one of you to think hard to find a disorder that is not due to either the genomic variability or the environmental variability. And me, in the last 20 years, I'm looking for one, and I found none. So first lesson, I jump ahead, is that we all have a genomic variability and we all have bad genes. So there are no privileged people and not privileged people. Everybody has bad mutations in her or his genome. And we have this because as I said, we have a lot of variants. And if I sequence only your genes, the 20,000 protein coding genes, you look at the bottom, we usually have 25,000 variants, 25,000 variants in our protein coding genes. And about 10,000 of those, they cause an amino acid substitutions. And for the aficionados in biology, amino acid substitutions are unusual and potentially dangerous things to have. So I'll show you a little bit of my bad genes. Here I am in my pedigree. I have 4 children, and I'm in my late 60s of relatively good health. However, when I stay up at night to prepare the talk for this event, or if I read many hours, or if I exercise for many hours, I develop a little bit of jaundice that is visible in my eyeballs, because I have a genetic condition called the Gilbert syndrome, due to a mutation in this gene here, UGT1A1, which is a common syndrome that's quite mild, actually. I also have in my genome bad mutations for terrible disorders. These 8 terrible disorders that you see here, one copy from my parents had a terrible mutation, and the other copy is normal. And because these disorders, we call them recessives, I do not suffer from the disease, but I'm a carrier, and I can pass this to the next generation. So I talked to you a little bit about my bad mutations, my bad genes, and the knowledge that led to this identification of the bad genes is only 0.34% of the genome. If I examine your genomes today, we cannot say anything more than in the 0.34% of our genome. We have a tremendous sea of ignorance yet. But with what we know, the little bit of this sector of the pie chart, we can make diagnosis for 4,592 protein coding link disorders, Mendelian disorders, and a few more common complex phenotypes that we call. So in other words, we need continuous research to learn more about the genetic variability in the rest of the pie chart in order to understand fully the importance of the variation of the genome in each one of us. Lesson number 2 is that we humans are all distant relatives. Well, as you know, humanity or our ancestors were started in Africa, and then through a movement, they move out of Africa about 60, 70,000 years ago. And then they went west and east. And about 45,000 years ago, we humans populated Europe. In our cells, we have power plants, organelles that make energy for the cells called mitochondria. And these mitochondria, they have a small ring of DNA outside of the nucleus it's called mitochondrial DNA, and it's about 16,000 letters, this mitochondrial DNA. And the peculiar thing about the mitochondrial DNA is that is inherited from the mother. Only the mother gives the mitochondrial DNA to the sons and the daughters, because the sperm that penetrates the egg does not give any mitochondria to the zygote. Therefore, if I'm here, all the mitochondrial DNA that I received from my mother, and she received that from her mother, and her mother, and her mother, and so on. So each one of us, we can trace back our lineage to the first mother on earth, or the first few mothers on earth. Now, to show you my pedigree, my ancestry, the type of maternal mitochondrial DNA that I have, I can trace back to a type of mitochondrial DNA that was about 180,000 years ago in Africa. Can we trace the paternal DNA? Absolutely yes. Males, as you know, have one small chromosome that's called the Y chromosome. Females have 2 X chromosomes, males have an X and a Y chromosome. And the Y chromosome is only inherited from your father. So the Y chromosome I inherited from my father, who was of Cretan origin, by the way. And then he received his Y chromosome from his father, and so on. So I can trace back my paternal lineage. And here's my paternal lineage. The paternal lineage entered Europe about 11,000 years ago, and I can trace back to the same place in Africa. So that means that all humans with different lineages, we have the same ancestors that lived in the middle of Black Africa. So the take-home message, which is important for the peace talk that we're talking about, is that all humans are distant relatives. Distant relatives. There are no really races. We all are alike. Some people very closely, and alike other people in a more distant way, but we all are distant cousins. Lesson number 3, we humans are a recent branch in the evolutionary chain. So we appeared on Earth, let's say about 200,000 years ago, but our ancestors, let's say the common ancestor between me and a mouse, lived on Earth about 70 million years ago. So we humans are a recent appearance on Earth. Why I say this? I say this because I can learn about the importance of the different parts of my genome by comparing my genome to that of other organisms. As you probably know, the central dogma in biology is that the DNA, the genome, makes RNA, and the RNA encodes a way to make proteins, the important molecules that do almost all the jobs in the cell. Now, imagine I take one of the proteins, the 20,000 proteins that we have in our cells, and compare this to the proteins of other species. So here's a protein that's called Diractor. It's a protein that I like very much because it's on chromosome. The gene of this protein is on chromosome 21 and is important for the intellectual development of individuals with Down syndrome and everybody else. So here is a part of the human protein with the letters of each amino acid. Yes. And then you see the sequence of the chimpanzee, rhesus, the mouse, the pig, the dolphin, the cows, the horse, cat, etc., down to the frog and the fish. And you see that this particular protein is almost identical in all the species. That is the best proof of the evolutionary process. And that is one of the best proofs that evolution keeps what is useful, does not change what is useful, and changes what is not useful. So the piece of the DNA that are important are conserved, and the pieces of DNA that are not important are not conserved. So what's important in the genome? We can learn this by comparison of the genomes of the different species. Comparison is a very, very common way of advancing science and make discoveries. Remember the Rosetta Stone in the British Museum that has the Greek in one part and the hieroglyphics in another part, the same text. And Jean-François Champollion, by comparing the two, he was able to decipher the hieroglyphics. He wrote to his brother, 1818, everything that I did is the result of comparison. So if you compare the genomes of human and monkey and elephant, you see the conservation of the genes and the conservation of other important elements. The lesson number 4 is we can also take advantage of the fraternity, if I can say, of all the living organisms on Earth to not only understand evolution, but help us in understand what is important in our genome and understand if a mutation that causes any phenotype is important or not important according to the evolutionary process. So the comparison of our genome to that of many other species help us understand what's evolutionarily important and greatly assists in genetic diagnosis. In other words, from the 25,000 variants that I have in my protein coding fraction of the genome, if I can do the evolutionary analysis, I can see immediately the 100 that are potentially important for causing a disorder, because these 100 are probably absolutely conserved in evolution. So the cat that you have in your home, or the Drosophila that comes in your bananas, or the yeast that brews the beer, could help us make a diagnosis in a fellow human being of several disorders because of the homology of the species, of the different species. So then I like to conclude this small expose, the why genome and peace. I give you two statements. All humans are close relatives, and what divides us, there are environmental things, like the different myths that we have, the different languages that we have, the different locations that we live, and all that are environmental things. And the second thing is that all humans have the same ancestry. In other words, we're all relatives. Now, you may say that the discovery of the genome is so important. Why the discovery of the genome does not have a Nobel Prize? That's an important question. It does not have a Nobel Medicine Prize because in the stipulation of the prize, Nobel said that the prize is given to people. And the genome, the deciphering of the genome was done by hundreds or perhaps thousands of people, biologists, physicians, bioinformaticians, biochemists, physicists, chemists, engineers, entrepreneurs, and many people took part of and contributed seriously to the deciphering of the genome that was done 13 years after the beginning of the Human Genome Project. Human Genome Project started the 1st of October 1990 and finished around April 2003. So a Nobel Prize for the genome will never be given, but I think, and I propose this to the appropriate committees, that a Nobel Peace Prize needs to be given to the genome, because the genome, as I said, could contribute to the understanding of the fraternity of all people and the relativeness of all of us to every other organism that it is on Earth. And the difference in the Nobel Peace Prize is that this could be given to organizations like Médecins Sans Frontières, for example, or other organizations. So there are several organizations that participated in the deciphering of the human genome, and therefore, my conviction is that the genome sequence deserves a Nobel Peace Prize. And with that, I thank you very much for your attention, and I thank again for the organizers for the invitation, and I wish you the best for the near future and the fight against this new virus that concern all of us. Thank you very much.
Thank you for your attention.
Dear all, eminent and most learned panelists, dear viewers in Geneva, in Athens, and around the globe, allow me to spare you the biographical data of our wise and knowledgeable dream team, as you may read them in detail at the program, and also, since time is of essence in those sessions, we all prefer to use the time we have to exchange views and the constructive ideas. Their observations, collected in vitro and in vivo, within the scientific community and among lay people in real life, in social and political interactions and their repercussions, will enable us to peacemakers and peace builders. It is my pleasure to ask Dr. Parirapti to deliver her remarks.
Peace in the COVID era. Safeguarding peace requires conditions that strangle with the tremendous effect of war and differ completely from its meaning. But what is peace and what is war? The meaning of war dominates since the world was created, not only in the human kingdom, but in the animal and plant kingdom as well. The warfare procedures since the world was created have many causes, and historically this has been analyzed and experienced over all generations until today. But if we wish to categorize wars, we could theoretically divide them into groups: wars concerning survival and wars about domination. First and foremost, all species are contesting in order to secure food and shelter, and afterwards domination. And now we have a new war era due to coronavirus. The coronavirus threatened survival, but also caused many other implications, such as a very painful distance among the species. The emergence of SARS-CoV-2 has created a number of diverse types of challenges that are unprecedented and characterized by great scientific challenges. Many questions and hypotheses have emerged due to COVID-19 similarities to other viruses that have caused serious disease and disasters in the past in the history of mankind. Of course, they are also different with past viruses, but the point is that COVID-19 is a virus that spreads rapidly with very fast contagiousness, but probably with different effects between men and women or people of different age groups in the same of different country. These differences are probably caused not only by the diverse ways that the pandemic is treated in different countries, but also due to very specific factors related to the virus itself and human organism. More precisely, the pathophysiology of the disease and the host cells of each organism as well intensify the differences between people in the deep understanding of severity of problems caused by corona and in the way that vulnerable groups of people can be protected. A variety of behaviors and reactions inside or outside their house exasperate the different types of survival and domination. We'll try to find the possible answers to each separate step of disease's progression. Through and possible procedure, however, will be based on certain data and on new research that emerge. With COVID-19 social cohesion, its trend and social exclusion is stabilized and deposed due to necessity. COVID threat not only the biological survival, but also survival as a whole due to repercussion of the working environment, the emotional and social area as well. This is because food is secured through working and emotional survival through human interactions. By coronavirus, we return to basic and we retrograde in every level of life. COVID-19 identifies with the ultimate war. There are wars, or there will come wars and anarchy as well between several countries, species and human under the threat of global microscopic invisible enemy who surrounding the globe inside this phospholipidic cover of its small invisible devious existence of amino acids, a virus and his spike S protein. The virus has unleashed snaky earthly war without rules, cutting off the progress and development, communication, social connection, biological expression among fellow beings, education, etc. This threat cannot be addressed by delay or by poor methods. Cohesion and cooperation are prerequisites for tackling this threat. Solving also other matters among all the actors involved can be a drastic solution, since in this war the existing and upcoming repercussions do not only harm the present but the future development as well. From my perspective, it is a very important and construction to remark virus implication and how these ones can contribute to peaceful survival and coexistence. economical, but primarily physical, emotional, and spiritual power, which are suffering today not only by the virus itself, but also from the repercussion of it in everyone's everyday life, are strongly required for development and progress. Only this way balance can exist. The fear that has emerged posed a threat to humankind in spite of their socioeconomical status. The virus harmed nations, leaders around the globe by affecting their strategies, policies, and human of every socioeconomic status, race, age, and gender. From the first moment, science and scientists are exclusively responsible with their strategy and guidelines. This forced them to rise to the occasion due to the fact that they are crucial for policy making. This remains to be proved. Answers about the role of science and its importance in this hard period. Every knowledge of science from classic to innovate one, at a time that we are all isolated in our homes and others with no place to stay, no food to eat, and no medical treatment, has not yet fulfilled our questions. There is no adequate evidence or answers in order to secure humanity. Hence, personal conflict and kind of civil war has emerged. Scientists today, actions and research will be responsible for the future. They should be able to restore the damage that COVID era has created. There is a need of substantial collaboration and harmonious international relations. Different countries around the globe have different issues to tackle with, but it is time to be united and create a globalized strategy to fight this hybrid warfare. We are all citizens of one world, and we are obligated to protect it and react as a global community against this invisible enemy. Security and safety without any kind of fear are the vital prerequisites for humans to be able to live, work, fulfill the basic needs and evolve. Scientists, education, research have the capability and responsibility to unify the world in this hard period and resolve equally the pandemic, because COVID-19 gave birth to inequality for once again. So, if we manage to take these threats visible, we can bring prosperity and solid quality of life. Scientists are those that can use instruments and technology to help humanity and convince governments, institutions, and all kinds of actors to invest in human and their future. Communication is vital for progress, exchange of view of knowledge, information, and feelings. The reduced alternative way warrants perception, judgment, and efficiency. COVID-19 has affected human relations on various levels, within the family, socially, in school, in the workplace. Although many agencies operate effectively, I would say, to achieve proper communication from the right and the necessary distance. This is, in the long run, deprives people of the need and right to their full vital functions. It hasn't been calculated yet whether all these affect both psychological and biological health, progress and development, and mental health in an independent way. The absence of creativity, laugh, and touch interrupts the normal functioning of human network. The solution can only come with the return of the fulfillment of human research. Social media and online communication have been the basic weapon of maintenance and survival of humans. Through those information, activities, situation, and human emotion were canalized through art and not only art. The honest and effective dialogue, cohesion, and cooperation between scientists of all expertise pose a challenge and a commitment. Medical sciences, humanitarian, economic, and cultural sciences are all obligated to provide insight, research, action, and result. Only through this solution will it be given. Hopefully, the meaning of human existence and life with this threat will become understood from leaders and people, as well as the need for mandatory cessation of fire in war zones and the safeguarding of peace in all levels of human activities in prosperous society. All over the world, every government's position on the problems of COVID-19 is made in a different way. They vary according to the different political ideological systems, government capabilities, personalities, or government officials, the different political and moral value of the people in each country. Also, their treatment is different for its leader and its system of health, research, education, and culture, depending on the capabilities of the state. The impact of the health and development and financial support of countries are different. Collaboration, then, on the last some common models, tests which can reduce the impact of this inconceivable change in people's daily lives, is more than necessary. In order for support measures to be effective, they must be based on research protocols that take into account the specificities of different peoples, the culture, eating habits, hygienic habits, and level of knowledge, so that help and psychological support for the largest population of each country until a solution is found in the therapeutic approach and treatment and transmission of the virus. Now, I would like to present next the message of President of Athens Medical Association and Regional Governor of Attica, Dr. George Patoulis. We thank him very much for addressing this event for peace and the COVID-19 in the framework of the Geneva Peace Week.
Καλωσορίζω από την καρδιά της Αττικής την Εβδομάδα Ειρήνης του Οργανισμού Ηνωμένων Εθνών στη Γενέβη και ευχαριστώ για την τιμή να συμμετέσχω φέτος σε αυτή την πρωτόγνωρη χρονιά της πανδημίας, κρίσιμη για το σήμερα και το αύριο των λαών και τις προτεραιότητες των κυβερνήσεων και των ηγετών του κόσμου. Ο COVID-19 κατέδειξε ότι οι μεταδοτικές ασθένειες έχουν την ικανότητα να διαπεράσουν τα εθνικά σύνορα, να αλλάξει τη ζωή γρηγορότερα από οποιαδήποτε άλλη απειλή γνωστή στην ανθρωπότητα και να ταξιδέψουν πιο μακριά και απειλητικά από τα σεισμικά κύματα, τις οικονομικές καταστροφές, ακόμα και από τις συνέπειες των συγκρούσεων και του πολέμου. Ο κορονοϊός μας οδήγησε αναπόφευκτα στην συνειδητοποίηση ότι για να αντιμετωπίσουμε σωστά το βάρος της παγκόσμιας νόσου χρειάζεται να κυριαρχήσουμε εκ νέου τους μηχανισμούς που καθορίζουν τη διεθνή συνεργασία και τις διεθνείς σχέσεις, αφού μια παγκόσμια υγειονομική απειλή μπορεί να υπονομεύει περαιτέρω την ασφάλεια και την ευημερία των εθνών. Ωστόσο, μέχρι σήμερα τα περισσότερα κράτη και η διεθνής κοινότητα βασίστηκαν σε μια απαντητική προσέγγιση στη διεθνή ασφάλεια της υγείας αντί της προληπτικής. Και μόλις τώρα τα κέντρα αποφάσεων συνειδητοποιούν ότι η πολυπλοκότητα της παγκόσμιας υγείας μας καλεί όλους να εξερευνήσουμε νέα διπλωματικά πρότυπα πέραν από τα διεθνή δίκτυα ανθρωπιστικής βοήθειας που αποτελούν μόνον απάντηση σήμερα στην κρίση, χωρίς να περιλαμβάνουν ή να περιορίζουν αποφασιστικά τις συνέπειες της. Όπως και ο ίδιος ο Γενικός Γραμματέας των Ηνωμένων Εθνών έχει επισημάνει εν μέσω της πανδημίας, η συλλογική ασφάλεια και η κοινή μας ευημερία δέχονται επίθεση σε πολλά μέτωπα από μια αδυσόπιτη ασθένεια όπως αυτή που ζούμε. Και πράγματι ο COVID-19 έχει δείξει ήδη ότι πλήττει την εμπιστοσύνη των λαών απέναντι στις αρχές και τις κυβερνήσεις, ανάλογα με την αποτελεσματικότητα που εμφανίζουν στον περιορισμό της επιδημίας. Απελευθερώνει δυναμικές βίας στην ικανότητα ακόμα και κατοίκων. Εκτροχιάζει επίσης τις ερμηνευτικές διαδικασίες σε περιοχές συγκρούσεων. Διευκολύνει απολυταρχικά καθεστώτα στην περαιτέρω καταπάτηση ανθρώπινων δικαιωμάτων και ανοίγει επακόλουθα νέους δρόμους και ορίζοντες στα δίκτυα του τράφικινγκ και της εκμετάλλευσης και εμπορίας ανθρώπων, όπως και σε νέα κεφάλαια της βιοτρομοκρατίας. Στις σκηνοφενείς συνθήκες που η ανθρωπότητα αλλά και οι κυβερνήσεις του κόσμου αντιμετωπίζουν στις μέρες μας, ο ρόλος της διεθνούς διπλωματίας έχει αναλάβει η ίδια η επιστήμη. Οι τηλεδιασκέψεις, αν και μέσω οθόνης, έφεραν τα κέντρα αποφάσεων σε σύγκληση με τους γιατρούς και τους ερευνητές από όλα τα σημεία του πλανήτη να ομονοούν και να εργάζονται από κοινού για την εξέβρεση λύσεων. Η κρίση της παγκόσμιας δημόσιας υγείας έκανε τους λαούς και τους ηγέτες να βιώνουν έμπρακτα και δραματικά την έννοια του παγκόσμιου υγειονομικού χωριού. Αναδύεται λοιπόν τώρα περισσότερο από ποτέ επιτακτικά η ανάγκη να αναβαθμιστεί σε υγειονομική διπλωματία ή διεθνής υγειονομική αλληλεγγύη, που στο παρόν έδωσε λύσεις σωτηρίας της ζωής των πληθυσμών. Όπως και σε εμάς, στην περιφέρεια Αττικής, που κατάφερε εγκαίρως να προθυμευτούμε μάσκες και προστατευτικά υλικά από την Κίνα, σε συνθήκες παγκόσμιων ελλείψεων στην αρχή της πανδημίας, με τη συνέργεια της διεθνούς επιστημονικής κοινότητας και τη βούληση των κυβερνήσεων, λοιπόν, οι διεθνείς υγειονομικές διπλωματίες πλέον καλούνται να βοηθήσουν στη διασφάλιση της παγκόσμιας ειρήνης και της ειρήνης των κοινωνιών, φτάνοντας και στο πιο ευάλωτο και στο πιο αδύναμο σε κάθε γωνιά της γης. Η ειρήνη στις μέρες της πρωτοφανούς υγειονομικής κρίσης στο παγκόσμιο χωριό σημαίνει ο ηγέτης και οι κυβερνήσεις στον τόπο τους με ευσυναίσθηση να προστατεύσουν τους ασθενέστερους, τους ηλικιωμένους, εκείνους δηλαδή που ζουν με αναπηρία, τους φτωχούς και τις διαφορετικούς και τους μόνους τους. Η ειρήνη στις μέρες της πανδημίας σημαίνει σύμπραξη της έρευνας του ιατρικού λειτουργήματος, αλλά και της ίδιας της πολιτικής επικοινωνίας σε ένα παγκόσμιο σύστημα ετοιμότητας και πρόληψης που θα υπηρετεί τη διάσωση της ανθρώπινης ζωής με ενσυναίσθηση και διεθνή αλληλεγγύη.
Ladies and gentlemen, it is a great honor for me to be greeting as significant an event as the Geneva Peace Week. Being the Secretary General for Public Diplomacy and Greeks Abroad, I deem the role of the diasporas of the world to be of the utmost significance.
Thank you. And back to Greece and the floor, it might go Crete and to Professor Achilleas Gravanis. Professor Gravanis, please tell us what is your view in this pandemic perspective.
First of all, I would like to thank Dr. Rapti for this very kind and honorous invitation, and I'm very happy to participate. I'm a pharmacologist working at the island of Crete and in Boston on the mechanisms of neurodegenerative diseases and brain aging, but today I chose to address a very important need for health and education in the developing countries during the COVID-19 pandemic, a very important, actually, socioeconomic issue. The coronavirus pandemic and the slowdown of economies globally could push as many as 60 to 70 million people into extreme poverty, annulling the long-lasting efforts to combat it. It is imperative to initiate emergency operations to help the developing countries with mechanisms that find and mobilize funding for nutrition, therapeutic supplies, And of course, it is very important to address on time this public health emergency. The mobilization of international organizations such as the WHO, the World Bank, and European Union and its institutions must focus on strengthening health systems, support the poorest households, protect access in education, and transfer technology and knowledge. With the help of the local governments, operations will deliver help to the poorest families through job support, maintain food security, nutrition, and continuity of essential services, actually such as education. The scale and speed of the international response is critical in helping countries mitigate the adverse impacts of the corona pandemic crisis and prioritize the human capital investment that can accelerate recovery. In my view, the following needs must be taken care. First, strengthen the health systems, the daily monitoring of patients, prevention, particularly in low-income countries, including strengthening countries' health systems to treat severe cases and save lives. Training and education programs for health professionals, including physicians, nurses, laboratory technicians, health administrators, must be undertaken. The strengthening of research facilities and academic hospitals will promote knowledge, health education, and facilitate local knowledge accumulation. The second issue is to provide medical equipment and supplies. Many developing countries import most of them, and in some cases, all of the medical supplies critical for fighting COVID-19, leaving them extremely vulnerable to supply disruptions and export restrictions. The third issue deals with education. At least a third of world's school children, about 463 million children globally, are unable to access remote learning when COVID-19 shattered their schools, according to UNICEF. At the height of nationwide and local lockdowns, about 1.5 million school children are affected by school closures. Lack of access to radios, so simple, television, computers, internet, and data left many students unable to engage in remote learning. Many children lack access to the internet, which is increasingly indispensable for education. Digital literacy for students, and not only, but for teachers also, is increasingly recognized as an indispensable element of children's right to education. Caregivers with no or low levels of normal education have greater difficulty supporting children with home learning. A particularly important concern relates to the factors affecting education of children with disabilities during the COVID-19 pandemic. I will close by underlining the need to effectively and timely support the developing countries in the pandemic era, and this must be the absolute today priority of the rich ones. Thank you.
Thank you, Professor Ravanis, for this insightful, inspired contribution. Back to Athens, and the mic goes to Professor Vasiliki Artinopoulou. Professor Artinopoulou, please share with us your scientific perspective.
Thank you very much, and I would like to thank the organizers and Dr. Parir Abdi for the kind invitation to participate in this interesting event. I will focus on a social issue, the gender-based violence during the COVID-19 pandemic. In concrete, I'd like to share with you my experience in the introduction of an evidence-based policy in the Greek criminal justice system. We're aware that during the pandemic, the national health policies were evidence-based. We had evidence from research and documentation consist the basis for implementing and reviewing the public health policies. Therefore, those policies became more convincing, technocratic, balanced, rational, and impartial. However, there is a huge gap in implementing evidence-based policies in the social level. We still have no evidence for the victims of domestic and gender-based violence during the pandemic and during the quarantine. The recent UN report, shows an increase in the reporting cases of domestic violence. And at the same time, the services are being compromised. I would like to share with you just, yes, this report from the UN. And for example, I said that in France, we have almost 30% an increase in the reporting of domestic violence during the quarantine. So the problem is really very important. And because the victims of gender-based violence and domestic violence have no voice during the quarantine, they were still silent. So in this context, it was really a positive surprise that came from the Greek Ministry of Citizen Protection to research domestic and gender-based violence during the quarantine period from March to May 2020. This research and the ministry aimed at drafting and implementing ad hoc policies for the crisis and for the victims of gender-based violence. So for this reason, and because it was a really innovative perspective, I'd like to present this case as a best practice bringing social change during the COVID era. The ministry asked from me as an independent expert in the field to design and conduct this research. The main questions of the research are for Greece. Is there an increase, decrease, or stability in the prevalence of gender-based violence during quarantine? Second, what forms of domestic violence the victim suffered from? Third question, what was the level of reporting of those cases in the Greek police or in other organizations like helplines, counseling services, shelters? And another question is to find out any similarities or difference between the economic crisis period. Don't forget that Greece has 10 years long economic crisis and the quarantine period. So we'd like to have a comparative approach in crisis settings. And the last question was what kind of support the victims needed for their safety during this period. So we draft an online questionnaire for the victims, and we have a special campaign, a dissemination campaign, because we'd like to have a big sample from women and girls from all parts of the country. So we shared the link of the research, and I have to say that we have many, many answers. I can't share with you the results because this research is still online. It is still in the air. And we plan to end the research at mid-October. So this research reflects the interest of the government and the interest of the government and the policymakers to help the victims of domestic violence. From my point of view, this research also reflects a paradigm shift in policy making in Greece. So I would like to come back later to share with you the findings in another event maybe. However, of course, I wish the pandemic will end very soon. But any useful lesson learned from the pandemic must be continued and after the pandemic. So at the end of the day, implementing evidence-based policies in the social level and strengthening the collaboration between experts, stakeholders, and policy makings will lead to innovation and social change. The issue, addressing the issue of gender-based violence is huge. However, we have some lessons learned. We need the victims to be and stay protected during the COVID era. So the governments have to take action. And I'm happy to contribute in this attempt in Greece. I would like to thank you very much and hope In our next event, we share the findings and the policies designed and implemented on the prevention of the secondary victimization and the safety of the victims. Thank you.
Thank you, Professor Artinopoulou, for your insightful observations. Professor Athanasios Vozikis, please share with us your perspective.
Dear fellow colleagues and friends, I'm very glad and feel honored to be invited by Simeon Sideropoulos, President of the Hellenic Association of Political Science, and Dr. Parir Apti, and to participate in today's very interesting discussion representing the Laboratory of Health Economics and Management of the University of Piraeus. I'll try to keep it short. I would like to briefly address the importance of the WHO in the COVID-19 times, an institution and organization that has been referenced so much by the governments, the media, and the people in general during the last months since the pandemic broke out. To paraphrase a quote that originally referred to the United Nations system as a whole, it was a great privilege for people in more developed countries not to know what the WHO is and what it does. It was not long, but in last year's Geneva Peace Week, where I highlighted the vital contribution of the WHO to international peace building. The WHO, recognizing the importance of health organizations' contribution to peace building, has taken up a leading role at international stage with the creation of the Health as a Bridge for Peace framework, an initiative that integrates the delivery of healthcare with conflict management, social reconstruction, and sustainable community reconciliation. I had also stated that in the 2020s world, new healthcare challenges will appear, and I highlighted the necessity for those to be addressed directly and effectively. Little did we know then the tragic extent to which that statement would prove to be true. Today, the WHO stands on the front line of international cooperation to fight the coronavirus, acting as a focal point for research results concerning COVID-19 to be distributed quickly and effectively to researchers and policymakers also. But unfortunately, this leading role has also put it in political debates as a tool for political gains, seriously undermining its capacity to act efficiently, not only now, but more importantly, in the post-pandemic era. What I would like the audience to keep from my intervention is this. It is important to remember that after this state of emergency that the pandemic has created for all of us, when people in developed countries will forget again about the WHO and they will turn to rebuild their own troubled economies and shocked societies, the WHO will have to actively engage in the reconstruction of healthcare systems in many developing countries and ensure that the aftermath of the pandemic there won't lead to conflict escalation. That means that all the countries, without any exemptions, although will have to face their own economic burden, cannot afford to turn away from the WHO and the support it needs, both financially and politically, to successfully confront the great challenges that lie ahead. Thank you once more for the invitation and your attention.
Thank you, Professor Vozikis, for your important contribution. Ladies and gentlemen of the panel and viewers, thank you all very much for helping to this contribution to peace.